morning all, and welcome to our third day of pre-licensing training. I hope you're all very well. I'm going to give folks just another minute to get into our virtual space this morning. We are expecting a few more attendees, and I see the number ticking upwards this morning, so that's great. So let's just we'll give folks another minute or two to get into Zoom this morning. And then we'll go ahead and get started with introductions and a few housekeeping items. If you have a question, you can put it in the Q&A. And while we wait for everyone to get into our virtual space this morning, I can look at the questions and get through them. I'm guessing they're of a technical nature this morning. I did see someone's hand raised. So that's how we'll answer questions. I can't hear you, no sound. Okay, can somebody else let me know if they can hear me okay?
Yep, you're okay right now, Shannon.
Okay, thanks, Mike. Lovely thumbs up, that's so helpful. It seems like question asker, it's something on your side. So we, suggest you check all the settings on your computer and try to get the sound. Seems like I'm coming through okay. Oh, great. Okay. Problem fixed. All right. We're at. Well, it looks like we've somewhat stabilized in terms of people getting into this space. So we're going to go ahead and get started. We have a lot to cover this morning. So I don't want to delay any time. So good morning and welcome to the third and final day of pre-licensing training. This training is for people who intend to become certified application counselors or navigators, as well as agents and brokers. But we of course welcome anyone who is interested in the content, and we're glad you're all here. I'm Shannon Drake Burr. I am covering Wisconsin's workforce and affiliates liaison. And today my colleague Jen Ball is joining as co-host to help out. So thank you, Jen. And also my colleague, Mike Morardi, who has been here all 3 days and is our technical expert, is joining as well. So thank you both, Mike and Jen, for your time this morning. I want to remind everyone that in addition to completing pre-licensing training, you must attend all main conference sessions in order to obtain all 16 pre-licensing credit hours, which are required by Wisconsin's Office of the Commissioner of Insurance in order to become a certified application counselor or a navigator. Main conference sessions will be September 28th through the 30th and October 3rd through the 4th, and they will be from 9 a.m. to noon each day. In today's first session, we will continue with Health Insurance 101, aiming to understand the different types of health insurance plans and the basics of the Affordable Care Act, which established healthcare.gov and also is called the Federally Facilitated Marketplace, or FFM, and sometimes is referred to as Obamacare. I just want you all to be familiar with all three of those names for the same thing. In today's second session, we will learn about the requirements to become a certified application counselor or a licensed navigator. We'll learn about Wisconsin state mandated health insurance benefits, as well as we'll do a little preview of navigating plans on healthcare.gov. If you have questions, please put them in the question and answer on the bottom of your screen. We will be monitoring questions and we'll take strategic breaks throughout the session to address them. And please know there will be polling questions throughout the session. The polling questions are interactive and will appear on your screen. Please make certain you respond to the polling questions. It is part of obtaining your pre-licensing credit hours. Do your best with the polling questions. It's about active participation, not getting the right answer. It also helps us see how comprehension of the content is going. So really, it's very helpful and we really want you to participate in the polling questions. We have a lot to cover this morning, but we'll take a break around 10:15 a.m. And with no further ado, I'm going to hand it off to Barbara and Shelly, who are our returning presenters from the Office of the Commissioner of Insurance.
Good morning. I thought just before we get started, and we had started yesterday with Health Insurance 101, and before we start talking about healthcare sharing ministries, which is where we ended up, just a couple of highlights of what we talked about yesterday. We talked about the difference between comprehensive coverage and disease-specific or duration-specific coverage. Comprehensive coverage offers a wide range of inpatient and outpatient services, while disease-specific is generally limited coverage for a specific disease or for something like being in the hospital. Duration-specific is limited coverage for a specific period of time. We also talked about the managed care definition. Managed care is a type of health plan that provides incentives for the members to use network providers who are part of the health plan contracted with the insurance company. And there are different types of managed care plans, such as exclusive provider organizations or health maintenance organizations, which limit most coverage for most services to care from plan providers or preferred provider plans, point of service plans, which often provide some more limited coverage out of plan. We explained that all of the plans shown on that are offered on the federal exchange on healthcare.gov are managed care plans, and they're qualified health plans. So I think we can go back to slide 16 and just wanted to give a brief reminder of what we talked about. Healthcare sharing ministries are not insurance. I think Shelly referred to them yesterday as the original GoFundMe types of plans. And they became more popular at the beginning of the Affordable Care Act because consumers could enroll in those as an alternative to coverage on the exchange. They are not required to cover pre-existing conditions. They can have other limits. And basically, they do not guarantee that all eligible claims will be covered. Generally, some plans will operate where they will send an newsletter out for someone regarding and include that someone's claim in there, and other members of the ministry can submit claims. So there's not a guarantee. Next slide. And we talked about this yesterday too, what types of plans that is not insurance and are not regulated by OCI. So I'll go through them briefly. Self-funded ERISA plans are typically offered by large employers. It's not insurance because the employer does not purchase an insurance policy. The employer retains the risk. And they're governed generally by the U.S. Department of Labor. Labor union and employee welfare plans are also governed by the U.S. Department of Labor. Discount plans provide discounts on some services that are provided by doctors and other healthcare providers who agree to take those discounts. They are not health insurance at all. It's more like a coupon. Medicare Advantage plans are a type of Medicare, and they're governed by the Federal Centers for Medicare and Medicaid Services, who contract with insurers to provide these plans. Medicare Part D is the prescription drug benefit for people who have Medicare. Healthcare sharing ministries, we just touched on. Finally, direct primary care, which we're seeing more interest in some providers, typically primary care providers, family practice, internists, then contract directly with consumers to provide some services. Next slide. We talked about this yesterday too, the different federal laws that apply to healthcare. Medicare is the broad program designed for the nation's elderly and some people under 65 who are disabled. The Employee Retirement Income Security Act of 1974, or ERISA, is a federal law that sets minimum standards for most employer groups in private industry who provide care coverage for their employees and the employees' families. The Consolidated Omnibus Budget Reconciliation Act, or COBRA, gives workers and families who lose their health benefits because their job changed or they left their job, it gives them the right to continue with their group health plan for a certain period of time. The Mother's Health Protection Act provides coverage or guarantees coverage for mothers and their newborn children for a certain period of hospital care when they're in the hospital, generally for 48 hours for a normal childbirth or 96 hours following a C-section. The Women's Health and Cancer Rights Act provides protections for patients who choose to have breast reconstruction following a mastectomy. The Health Insurance Portability and Accountability Act assured that provided protections for employees who were changed jobs or for consumers who changed from one job to another. And it eliminated the ability of the new health plan to impose a new pre-existing condition period for those people. It also has protections in it for the privacy of health information. The Mental Health Parity and Addiction Equity Act requires health plans that provide mental health benefits from imposing more restrictive annual or lifetime limits for mental illness than are imposed for physical illnesses. The Patient Protection and Affordable Care Act ensures that is the ACA, and that's our main focus today, since that's is what set up the federal exchanges, and it eliminates the pre-existing clause and requires health plans to individual health policies to accept all individuals. Finally, the No Surprises Act is a relatively new act that became effective January 1st of this year, and it protects consumers who may have received unexpected balance billing when they go to an out-of-network provider in some situations, such as emergency care. Next slide. If Federal Affordable Care Act, also referred to as the Patient Protection and Affordable Care Act, is the most significant change in federal health insurance law since Medicare. It addresses quality of care, cost of care, ability to enroll in an insurance policy. Some of the reforms that began in 2010, some did not begin until 2014. The federal exchange became effective, policies on the federal exchange became effective in January of 2014. Some of the health reforms include prohibiting lifetime dollar limits and annual dollar limits on essential health benefits, requiring coverage of certain preventive services with no cost sharing, guaranteed issue of insurance policies, and as I said, prohibiting pre-existing condition limitations. Although the Affordable Care Act is a federal law and the exchanges we use in Wisconsin, we use the federal exchange. OCI's mission remains the same. We continue to be the primary regulator of health insurance in Wisconsin. Next slide. Okay. No consumer who signs up for coverage on the exchange during the open enrollment period can be refused coverage or can have their coverage reduced because they have a pre-existing health condition. There are 10 minimum essential health benefits required to be covered under the Affordable Care Act, and they are ambulatory patient services, which is your general outpatient services, emergency services, hospitalization, pregnancy, maternity, and newborn care, mental health and substance use disorder services, prescription drugs, rehabilitative and habilitative services and devices, laboratory services, preventive and wellness services, and chronic disease management, and pediatric services, including oral and vision care. And I'll just add a comment that because mental health and substance use disorder services are required as an essential health benefit, the Mental Health Parity Act does apply to individual health policies that are sold on the exchange. And the out-of-pocket limits shown on the slide are for 2023. So for individuals, it's $9,100, and for a family, it would be $18,200. And that's, as I said, we said yesterday, the out-of-pocket limit is the maximum amount that member has to pay for covered services, most covered services. Next slide. Insurance companies may only vary the premium amount for a particular plan based on the 5 items listed here. And as I explained yesterday when we talked about pooling of coverage, and that spreads the risk among all people who are in a particular plan, these are the restrictions placed on insurers that help pool coverage for everyone who enrolls. And those 5 include where the coverage, or whether coverage is for an individual or for a family, the area of the state the plan is sold in. There are, I believe, 16 different, the state is divided into 16 different areas for determining the premium rate. The age of the individual applying, whether the individual uses tobacco, in the plan category. The plan categories are often referred to as metal tiers, and they are based on the actuarial value, and that means the average amount that the health insurer expects to pay for healthcare services of the plan. And that's the average amount for all of their members enrolled in that plan. The bronze is has the least amount of benefits. It's 60% of covered services, silver 70%, gold 80%, platinum 90%. Next slide. Open enrollment is the period of time when a consumer may enroll for coverage, purchase an individual health policy, or make changes and updates to their healthcare policy for the upcoming year. This year, open enrollment is from November 1st through December 15th. And plans that are purchased at that time will have an effective date of January 1st of 2023. If outside of this open enrollment period, a person can generally enroll in a health insurance plan only if they qualify for a special enrollment period. Next slide. Special enrollment period is the time outside of the open enrollment period when the individuals can sign up for health insurance because they've had some type of change in their life events. And there are various reasons that they may qualify for a special enrollment period. And it could include losing existing health coverage, including losing a job-based or individual plans, turning 65 and losing their coverage under their parents' plan, getting married or divorced, having a baby or adopting a child, or a death in the family. Or if they move to a new zip code or a new county, they may be eligible for a special enrollment plan. And depending on the specific life event, they may have up to 60 days before or 60 days after to enroll in a plan on the exchange. Next slide. Okay, we have come to our polling question for this morning. Special enrollment periods allow individuals to enroll in the ACA outside of the normal enrollment period when that person, A, decides a different plan would be more cost effective, B, receives a promotion at work, C, loses eligibility for Medicaid, or D, is diagnosed with a serious illness.
Great, thank you, Barbara. Everyone, please respond to that polling question. And then I just wanted to provide a small correction, which is that this year or this open enrollment season, open enrollment will go through January 15th. So
It does.
we saw a change to that, we saw that open enrollment season extended last year when the the federal administration changed over, and that change is going forward this year as well.
I knew it was last year. I wasn't aware. So thank you very much for that correction.
No problem at all. Actually, one of our participants picked up on it. So thank you, Kelly, for pointing that out. You are correct. One important thing to know as you all continue to work on that polling question about the extension into January is that if folks want a plan that begins on January 1st, they still do need to enroll by December 15th in order to have that January 1st start date. And if they enroll after that, their start date will be later. So I see we're at 88% participation. Last chance to get your answers to the health insurance polling question. Special enrollment periods allow individuals to enroll in the ACA outside of normal enrollment. Win that person and then select an answer. We're going to close it out now.
Okay, 80% chose loses eligibility for Medicaid, and that is the correct answer. The special enrollment periods apply if someone has a life event where, such as losing coverage, other health coverage. Okay, and I think Shelly is going to take over with the next group of slides.
Good morning, everybody. Happy Friday. We made it. So I will take it from here, Barb. Thank you. The state of Wisconsin continues to offer a highly competitive market for consumers looking at the exchange. We do require an insurer to offer the same plans off exchange in the individual market as well. The interactive map on our website allows you or a consumer to narrow the available plans down to the county the consumer lives in. It lists what type of plan is available in that county, like an HMO, a PPO, POS, and a contact phone number for the plan. It will also, when you click on, we'll say Molina or GHC or Anthem, there'll also be a link there that will take you directly to that company's website. Next slide, please. The payment of a claim is not overdue until 30 days after the insurer receives proof of loss required under the policy or equivalent evidence. Also, a delay in payment may be justified if the insurer cannot determine to whom the claim should be paid to. The date of payment is the date a check or payment was properly mailed, or if not mailed, the date of delivery of the payment. The interest on claim statute does not apply to self-funded plans, Medicare Advantage plans, or Medicaid plans, along with those providers that have a provider agreement with the company. Next slide, please. Under the Affordable Care Act, health insurance companies cannot refuse coverage or charge you more just because you have a pre-existing condition. That is a health problem you had before the date that the new health coverage starts. However, policies not subject to the ACA, such as short-term limited duration or fixed indemnity policies that Barb touched on earlier, may continue to have this pre-existing condition limitation. A health insurance company may use different criteria or definitions from what a healthcare provider may use. And obtaining medical records is the company's way of determining whether a condition was pre-existing or not. Next slide, please. If a consumer or provider disagrees with an insurer's determination, they have the right to appeal through the grievance process. All insurers that issue health benefit plans must develop an internal grievance procedure. Insurers are required to file with OCI an annual grievance report to show how many they have handled, meaning grievances, how many they have handled during that previous year. The independent review process provides the insured or the provider with an opportunity to have medical professionals with absolutely no connection to their health plan to review a dispute. The IRO has the authority to determine whether a treatment should be covered by the health plan. Please understand that examiners at OCI cannot and do not make medical determinations as we are not medical professionals. Next slide, please. And we've quickly come to the next polling slide. So the question is, which of the following is true? A, short-term plans are required to provide coverage for pre-existing conditions. B, qualified health plans under the ACA are required to provide coverage for pre-existing conditions. C, OCI is able to make medical determinations regarding pre-existing conditions. Or D, filing an action in court is the only way to resolve disputes regarding pre-existing conditions. We'll give you a couple moments, obviously, to review and answer that question.
You're doing great, attendees. We're at 77% participated. We'll give you a few more seconds to get your answers in. Please respond to the question that should have popped up on your screen, asking which of the following is true. All right, why don't we go ahead and wrap it up?
And we have 79% that say B. The following is true, that qualified health plans under the ACA are required to provide coverage for pre-existing conditions. And that is the correct answer. Again, like we just kind of briefly went over there, short-term plans do and are allowed to have that pre-existing limitation. I cannot make a medical determination. I'm not a medical professional. And there is the grievance or the IRO process that can help resolve disputes. So those are always available to consumers as well. All right. The definition of medical necessity is not in Wisconsin law or statute, as it's defined by an insurance company, and the company's opinion of necessity can differ from the provider's opinion. Thus, the reason that the grievance and IRO procedures were developed and created in the first place. Again, as we previously talked about, examiners at OCI cannot and do not make medical determinations, as we're not medical professionals. For example, some of the most common complaints that we do see are differing opinions between companies and providers on, let's say, the number of sessions for physical or occupational therapy, or if a surgical procedure is a necessary procedure. That's where the IRO process and making sure that an insured or a provider has exhausted as many levels of appeals and grievances that they can to make sure that different people are able to take a look at things, because it's just not something that we can make that determination on. Next slide, please. In any state, there can be challenges geographically to ensure that there are adequate numbers of providers for a number of the plan's enrollees. We have definitely received complaints in the past concerning the number of providers within an area. The network adequacy statute does not define how many providers must be located within a certain mile radius. However, we do ask companies in these cases to work with their members to help find providers for their needs or their specialties, or work with them to possibly approve seeing someone outside of the network if a provider cannot be found. Next slide, please. All ACA compliant plans must have embedded out-of-pocket maximums. All family deductibles must be no more than double the individual deductible rate under the ACA. So for example, as it lists there, if the individual deductible is $3,000, a family deductible cannot be more than $6,000. This measure is to alleviate the financial stress on smaller families. This can sometimes be confusing. Make sure to check the policy and ask questions. How and what accumulates towards the deductibles and out-of-pocket maximums? Next slide, please. There are two types of different deductibles, but the difference matters only for plans covering more than one individual. The difference has to do, again, with the amount an individual or family must reach before the insurance company begins paying for expenses. Embedded deductible means one family member can contribute more than the single amount towards the family's deductible, and this can help alleviate the financial stress on smaller families. In the case of a non-embedded deductible, a family can apply to a member, spouse, children, or all of the above. So it can take a lot longer to reach those maximum out-of-pocket limits when you have the non-embedded deductible option. Next slide, please. For a consumer to fully understand the cost of their health insurance plan, you must be able to explain, and I would advise you to start with advising them that not only to take the premiums into account, but also the cost sharing. You need to remember that the amount out of pocket may exceed the stated out of pocket amount as well if a copayment does not contribute towards meeting that out of pocket amount. This must be defined within the language of the policy. So, for example, you may need to go see a specialist, or the consumer, I should say, may need to go see a specialist. For that particular type of specialist, there may be a $50 copay, and it's possible that that may not go towards the maximum out-of-pocket limit. It is extremely important for a consumer to understand that possibility when making these plan choices. Next slide, please. The next few slides show a sample that I found on the healthcare.gov website of the summary of benefits a company is to provide its members. The summary of benefits is a snapshot of a healthcare plan's cost, benefits, covered health services, and other features that are important to consumers. The summary of benefit also explains the health plan's unique features like cost sharing rules and other significant limits and exceptions to coverage in fairly easy to understand terms. Next slide, please. So again, we're going to see over the course of the next 3 or 4 slides, kind of just snapshots that you'll find on that healthcare.gov. You can also obviously probably go to an Anthem website and find some of these summary of benefits for the types of plans that they offer. But it's definitely important to understand where the numbers are coming from and to be able to explain to your consumers that it's not only about the premium, but there also could be deductibles, the out-of-pockets. Sometimes, again, like I just said, the out-of-pockets don't go towards the maximums, or excuse me, the copays don't go towards the out-of-pocket maximum. So they need to understand the full financial impact of what this plan may cost them in a calendar year. Next slide, please. So again, it just continues to go through the possibilities of in-network, out-of-network, if you're having a baby, if you need a hospital stay, those types of things. Next slide. There are some of the excluded services, again, under this example, that, making sure a consumer understands that, infertility treatments are not covered, staying inside the US, routine care for some things may not be covered under these plans. Next slide, please. I think that's actually just a duplicate of the one I had a couple moments ago. So thank you. We'll just continue on. Wisconsin's mandate applies to all group health policies covering hospital care with an exception for groups of less than 10. The mandated benefits begin with our statute 632-895 sub 9, the coverage of drugs for treatment of HIV. And they do apply to self-insured by a county board, by a city or village, by a local government union or technical college district within the state of Wisconsin. Some self-insured plans and governmental units will use a TPA or a third-party administrator to administer the plan and pay the claims. Next slide, please. Group health insurance policies and self-funded state and local government health plans must provide coverage for mental disorders, alcoholism, and other diseases. This includes inpatient, outpatient, and transitional treatment for alcoholism, drug abuse, and mental nervous disorders to ensure that the financial requirements and treatment limitations on mental health or substance abuse disorder benefits are no more restrictive than those restrictions on medical or surgical benefits. Group health policies are required to provide coverage for transitional mental health, alcohol, and other drug abuse treatment arrangements such as day hospitalization. HMOs, in addition to covering the mental health services described above, are required to provide certain benefits for outpatient treatment of nervous and mental disorders, alcoholism, and other drug abuse as dependent students who are attending a school or higher education located in the state but outside the HMO service area, especially if the HMO would provided those benefits for such services if they had stayed within the service area. Next slide, please. For preventative care services, these are not subject to cost sharing when delivered by a doctor inside the insured's network. The COVID-19 immunization is a preventative care service. Under high deductible health plans, first dollar coverage is only available for certain preventative care benefits, such as the annual physical. And under the U.S. Preventative Service Task Force, there is a list of these quote unquote preventative services that should be covered under a plan's health care. And we've provided you with the link there on the slide to their website. Next slide, please. Again, as Barb previously stated, COBRA is the federal law that allows most employees, spouses, and their dependents who lose their health coverage under an employer's group health plan to continue coverage at their own expense for a period of time. COBRA applies to insured health plans and self-funded employer-sponsored plans in the private sector, and those plans are sponsored, and those plans that are sponsored by state and local governments, and applies to employers that have 20 or more employees. Next slide, please. Wisconsin continuation law applies to most group health policies providing hospital or medical coverage. This law applies to group policies issued to the employers of any size. Additionally, employees who live outside the state of Wisconsin during employment with an employer located in the state of Wisconsin would be eligible for continuation coverage. The law does not apply to employer self-funded health plans or policies covering only specified disease or accidental injury. When both laws apply to group coverage, it is the opinion of our office, where federal and state laws may differ, that the law that is most favorable to the insured should apply. Next slide, please. Separation from the employer cannot be for gross misconduct. It must be, again, like we've talked about, for involuntary or voluntary reduction in work hours, those types of scenarios. The individual or consumer is also responsible for paying 100% of the premium when they elect the COBRA coverage. You along the way may be asked, am I eligible for a special enrollment period under the ACA if after I chose COBRA, I decide to drop my continuation coverage or just stop paying the premium during that time I'm allowed to stay on COBRA? The answer is no. A consumer would not be eligible for a special enrollment period if they voluntarily cancel their continuation coverage before an 18-month period of eligibility has been exhausted and they are outside the period for the open enrollment. As stated in that last slide, the employer is responsible to notify the employee of their rights of continuation under the COBRA or state continuation as well. And last slide, we've come to the end. Turn it over, I guess, to Shannon or Mike. Any questions from our participants?
I'm not seeing any questions. Thank you so much, Shelly. We'll give folks a little bit of time to enter any questions. Since it is 9:46, we are going to keep going with the next slide deck, which I will get up on my screen now. So just give me a second.
Same
maybe
here.
I was paused there.
Yep.
Okay. And we'll transition over. So audience, just give us 1 quick minute to get things switched over and then we'll proceed. We will pause during the second presentation to take a break because I know people have needs, but we have a lot of content to get through before noon today. So we want to maximize our time. So if you've got a question, make sure you get it in the Q&A. Otherwise, just sit tight for 1 minute. Okay, Shelly and Barbara, are you ready?
Yes, and I think I'm going to take the first slides here.
Okay, audience, I hope you're ready.
Okay,
Take it away.
next slide. Again, this is just our mission statement, emphasizing that our office is very concerned with protecting and educating consumers. Next slide. The navigators are defined as an individual or an entity that performs any activities and duties on behalf of the federal exchange and who receives funding from the exchange. Navigators are licensed by our office and must complete federal training in addition to Wisconsin training and pass the exam. And I'd just like to point out that website for the federal training information has a lot of information, the marketplace.cms.gov. When I worked more frequently with health insurance, I often looked at that website for some of the information they had on a very wide range of topics. Next slide. Certified application counselors are non-navigator assisters who work for organizations that have been designated by the Federal Exchange as a CAC organization. You may sometimes see them referred to as CDOs, which is a CAC designated organization. And they're generally entities such as hospitals, clinics, federally qualified health centers, possibly some of the nonprofit organizations. CACs must also complete the state training and federal training and pass the Navigator exam. However, CACs are not licensed by our office. They are registered to our office, submitted a registration by the CAC organization. The individual CAC is not required to submit anything to OCI and does not need to be fingerprinted. Next slide. Okay, this is the landing page on our website that has all of the information for navigators and CACs. And you can find this page by going to our homepage, which is oci.wi.gov. And then if you click on the agencies link, which is the second link in that blue bar, which is below our name, and that gets you to the agent page. There are 3 columns on that page that, and if you go down the left, scroll down the left column to the other license types and click on that link, you'll get to the Navigator and CAC information, and just go down to whatever section you're interested in, individual navigators, individual CACs, click on the plus link on the right hand side there, and you'll find your information. And I think Shannon just gave you the direct link to that page, but sometimes people want to go through the, start with the home page and just see what's there. So I wanted to show you how to find it from our homepage too. Next slide. This lists the requirements to become a navigator. There are 7 basic requirements. Must be 18 years of age, a resident of Wisconsin, complete the Wisconsin pre-licensing training, complete the federal training requirements, pass Wisconsin's written navigator exam, and then submit fingerprints and have a background check. And it must be affiliated with a navigator entity. Next slide. Okay, our first polling question. Which of the following is not a navigator licensing requirement? A, be fingerprinted and receive a background check. B, be appointed with an insurance company. C, be a resident of Wisconsin. Or D, be affiliated with a navigator entity. Which of those is not a requirement to be licensed as a navigator?
You're doing well, everyone. I'll give you another 20 seconds to answer the question, which of the following is not a navigator licensing requirement? Great, let's close that out.
Okay, 78% chose B, be appointed with an insurance company, and that is the correct answer. And to be licensed as a navigator, you must be fingerprinted and you will receive a background check. You must also be a resident of Wisconsin and be affiliated with the Navigator entity. But you cannot be appointed with an insurance company. It's not a requirement. Next slide. A licensed agent, insurance agent, may apply to work as a navigator if the agent has an active resident license with accident and health lines of authority and completes the Wisconsin and the federal training. They may apply to work as a navigator. However, they cannot have any active appointments with an insurance company, and they cannot receive commission while they are a navigator. Just like any navigator, they must be affiliated with an insurance company. Next slide. Okay, this is the requirements, and there is a link here to the direct page of our OCI page on navigators. Generally, I went over this a little more closely. Navigators must complete the 16 hours of accident and health pre-licensing. They must complete the federal requirement for training. They must schedule and pass the navigator exam on the PSI website. That information is on our in the navigator section of our website. And then they must submit their fingerprinting prints, and we will do a background check when they submit the individual navigator application. Navigators their license must be renewed annually. And to renew a license, they must complete 8 hours of accident and health specific continuing education. They must complete the federally mandated training requirement, be affiliated with a navigator entity, and submit their renewal application. They can do that online through www.nipr.com. And that stands for the National Insurance Producer Registry. There is a renewal fee and a processing fee for that. And any additional documentation they would send to our agent licensing section, which does the renewals. Next slide. Certified application counselors must complete the same pre-licensing education and for Wisconsin and the federal education. They must pass the written navigator examination. And so this lists all of that. It's basically the same requirements as far as training and the exam as navigators. The difference is that because they are not licensed, they do not have to submit fingerprints, and they will not receive a license or certification from OCI. They will receive their certification from the CAC organization that they work with, and the organizations will register their names with our office. Next slide. Okay, and this summarizes the requirements: complete Wisconsin training, complete federal training, pass the navigator exam, be affiliated with CAC organization, which is responsible for registering the individual CACs with OCI, and is also responsible for the conduct of the individual CACs. And they must also complete 8 credits of continuing education every year.
So if you don't mind, Barbara, I'd like to pause here because
Okay.
people often get a little confused in this multi-step process. So I just want to give people an opportunity to ask questions to clarify either between the role of navigator or certified application counselor, ask about the federal training or the examination. And also just to clarify, the training that you're attending this morning and have attended for the last the prior 2 days, plus the rest of covering Wisconsin's 2022 Health Insurance Enrollment Conference, is your pre-licensing training. So when all the sessions conclude, you will receive a certificate for the 16 hours of pre-licensing training with your name on it, and you will have completed that aspect of your requirements. Are there any questions? All right, no questions. We shall proceed.
And yeah, it can, I agree, it can get confusing. And if you go on our website, that we try to walk you through what you need to do, whether you want to be a navigator or a CAC. And you can contact us with any questions at any time too. Navigators and CACs are permitted to do certain things. The permitted activities include conducting public education about the qualified health plans that are offered on the federal exchange. They may distribute fair and impartial information concerning enrollment on the federal exchange and the availability of premium tax credits and cost sharing reductions that may be available. They may explain that plans are available through the federal exchange or off the federal exchange. As Shelly said, all of the plans that offer coverage on the exchange must also offer coverage off the exchange. And they may want to suggest that the consumer talk with a licensed health insurance agent about all of their health insurance options if the consumer has questions. Navigators and CACs may facilitate enrollment in a QHP through the exchange. That could include outlining the information that the consumer will need to assemble in order to apply for coverage. And they may help the consumer access the federal exchange. They may explain to the consumer about their potential eligibility in the public government programs, and the sessions you had from the Department of Health Services on Badger Care and the programs that they offer gave you a lot of information about that. They may explain how the premium tax credits and cost sharing reductions work. They may describe the features and benefits of health coverage. In general terms, explain cost sharing mechanisms, what a deductible, copayment, or coinsurance is, how they work. They may describe the summary of benefits document and how the consumer can locate the summary benefit documents. They may explain how to find information about provider networks, what a provider network is, and what the consumer should consider when they're looking at plans regarding provider networks. Describe the different metal tiers. We said those are the bronze, silver, gold, and platinum, and how benefits may change depending on the metal tier. They may provide information that is culturally and linguistically appropriate for the individual consumer or for the population that they're looking for if they're providing just general education material. And finally, they may refer the individual to the appropriate state or federal agency if the consumer has additional questions or has problems or complaints. Next slide. What can navigators, or what are navigators and CACs prohibited from doing? They cannot receive compensation from an insurer or a healthcare administrator. They cannot provide any information related to enrollment for products that are offered off the federal exchange. They may not make or cause a false or misleading statement. Hopefully you understand you cannot make false or misleading statements to consumers. That's not in their best interest. They cannot provide advice comparing health benefit plans and indicate some plans may be better or worse, including recommending a specific health plan or insurer. Their advice should be factual and it should be neutral. And any information they provide must be accurate, must be factual, and they have to consider any information that the consumers tell them. They must maintain in privacy. Any individuals, as we said later, the office has the right, the commissioner has the right to enforce these requirements if we determine that an individual or an entity is not complying with these requirements. Next slide. Okay, this provides an outline of what will be on the Navigator examination. There are 35 questions on the exam. This shows the breakdown of how many items in each of the different areas. When you go on our website, there's a more detailed outline available in the candidate information bulletin. And that there's a link to that bulletin in both the individual Navigator and individual CAC FAQs. And that provides the different topics under each of those general outlines. And for example, it will tell you that, let me just pull it out for the basic health insurance concepts. You should understand the types of comprehensive health insurance plans, HMOs, PPOs, point of service. You should understand what an accepted benefit is, insurance terms such as co-payments, deductibles, co-insurance. So it gives you the types of the topics that you may see on the exam. Next slide. Okay, this is just a summary of what's required for navigators and what's in the FAQs. It has information on the exam process, what you need to do for the exam, and there's the links to our agent licensing section if you have any questions. Next slide. Next slide.
We do have one question that
Okay,
I
great.
want to address before we get to this slide, which we had someone ask, what is the main buy-in to become a licensed navigator? So I'm assuming the question is like, you're thinking like, well, I am working to become a certified application counselor. What's the difference between that and a navigator? And I can just clarify that for groups like ourselves, like Covering Wisconsin, we are funded by the Centers for Medicare and Medicaid to be a navigator entity. And so the people who work either directly for Covering Wisconsin or who have what we call subawardee agreements with Covering Wisconsin must become navigators, and their ability to be a navigator is attached to that status that is given to us through our relationship with the Centers for Medicare and Medicaid. For folks who are out in the community, at community health centers, at hospitals, at other community-based organizations, those organizations enter into an agreement with CMS to become something called a Certified Application Counselor Designated Organization. And that's an agreement, but it doesn't come with money. And so that is sort of the difference. And because of the funding that we receive, that Covering Wisconsin receives from the federal government to do this work, navigators have a few additional obligations that go beyond what certified application counselors must do. So just to give you that background.
Okay, thank you. That was very, I hope that was helpful, because I thought that was very good. Okay. Open enrollment. As we said, the open enrollment, this is when a consumer can purchase an individual health plan or make changes to their health plan for the upcoming year. And I'm glad this slide has been updated. Open enrollment this year is from November 1st through January 15th. Yes, Shane, thank you, Shannon. And except you've got January 15th, 2022.
Yes, I see in my rapid attempt to update the slide, I still made an error.
But I appreciate that you did make the change. And plans sold before December 15th will have a January 1st effective date. Plans sold after January 15th will not become effective until February 1st. Outside of the open enrollment period, only a special enrollment may apply for someone who has a qualifying event, life event. Next slide. Okay, and this again lists the different types of special enrollment periods that may be available, the types of experiences, losing health coverage, whether it's job-based, individual, and as the polling question asked, if you lose Medicaid, you would have a special enrollment period, getting married, moving, losing coverage, may give you the right to a special enrollment period, and that's generally a 60-day period. Next slide. Okay, we've come to the next polling question. Special enrollment periods are available for individuals when they A, are no longer eligible for Medicaid, B, receive a promotion at work, C, find an insurance plan that they like better, or D, want to change their primary care doctor. So which of those would give someone a special enrollment period?
All right, we're doing pretty well. We're at 83% participated. So get your answer in to the question. Special enrollment periods are available for individuals when they. We'll give folks maybe 10 more seconds. We're up to 89% participation, so that's great. All right, I think we can wrap it up.
Okay, 98% chose are no longer eligible for Medicaid, which is the correct answer. So that's great. Okay, a couple more slides. As Shelly had mentioned earlier, Wisconsin has a very competitive individual health insurance market. This year, there were 14 insurers offering coverage on the exchange, and those insurers plus one additional offered coverage off the exchange. This year, there were at least 2 insurers offering coverage in each of Wisconsin's 72 counties. And although the offerings for next year have not been finalized yet, from what we've seen, we do not expect any significant changes for next year. And there's also the map that Shelly mentioned, that you can drill down by county from that to the individual county for that map to find information on the coverage that's offered in that county. Okay, are we ready to take a break?
Yes, we are ready to take a break.
Okay.
Oh, I don't know where we are in terms of the slide deck, but it is 10. How many slides are we away from 23? I can't advance without.
Basically, Shannon, we're 2 slides away if we could squeeze it in, and then I would take over. I think it's just a clean break if Barb and you don't mind.
Okay.
That would be perfect. Sorry, group. All right.
And I think
2 more slides and then we'll take our break.
And I think what we're talking about in the next couple of slides are, to some extent, reviews of what we talked about yesterday and today. An insurance policy is a legal contract. It's subject to contract law as well as Wisconsin law. It generally applies to policies that are sold in Wisconsin. We talked about the agent is an agent of the insurance company, and so a notice to the agent is considered the same as notice to the insurance company. And the insurance company is bound by acts of the agent within the scope of the agent's apparent authority. We talked about representations, oral and statements made by the applicant. Misrepresentation would be a major misrepresentation, significant by the applicant. We talked about privacy protections. HIPAA, the federal laws, HIPAA and Greenleach-Bliley have privacy protections, and Wisconsin has similar privacy protections. And there are requirements for navigators and CACs, which I believe you'll see in your federal training for under the ACA regarding privacy. And finally, anyone has a right to file a complaint with our office. We review any complaint that we receive to determine whether we can assist that consumer. Next slide. Okay, and Shelly went through most of this yesterday too, and some this morning. A claim, in most cases, since all of the coverage on the exchange is managed care, in most cases, the provider will submit the claim, but there may be cases where the consumer needs to submit that proof of loss, such as if they need to fill a prescription while they're out of the area, they may need to submit that. We expect insurers to promptly settle all claims, generally within 30 days of when they receive the claim or receive the information they need. A mistake, in most circumstances, a mistake does not void a contract. The insurance company still has to comply with everything, all of the required laws in the contract. And we talked about, Shelly talked about the right to return, which must be stated on the policy. It's always a good idea when someone receives an insurance policy to look at it right away to make sure it is what they thought they were applying for. We talked about grace periods, which is the period that a consumer has following to pay a premium after the premium is due. And finally, Shelly talked about the internal grievance procedure. All health benefit plans have an internal grievance procedure to review a person's complaints, and in Wisconsin, grievance is defined very broadly as any dissatisfaction that's in writing on behalf of the insured person. So it's a very broad definition. The insurance company is required to review it, try to resolve the problem, and respond to the consumer. And if that doesn't resolve the problem, there's an independent review process. If the dispute involves medical judgment, and that allows the dispute to be reviewed by a medical professional who has no connection to the insurance company, and the independent review organization's decision is generally binding on the insurance company. And I think that we're there, ready for our break.
Oh. We're going to return from our break and finish our content this morning. So the final stretch, last hour and a half of pre-licensing training. Shelly, are you there?
I am here.
Great. All right, are we ready to commence?
I sure am.
Perfect.
So the one thing I guess I want to point out to you all is a few slides back, Barb had a breakdown of the 35 questions on that Navigator examination. And so these slides, what we've tried to do in creating them is to give you the information that you're going to need in order to pass that exam. So yes, there are definitely times when we duplicate things that we're saying, but obviously we feel those are probably the most important things that you need to remember when you begin that studying for the exam. So Shannon, are you able to get the slides up and going? There we go. So again, the definition of risk in insurance is the uncertainty of a financial loss. Risk tolerance is the amount of risk that one is willing or wanting to take on by themselves or can even afford. Insurance is defined as the transference of risk. A person pays the insurance company to take the financial risk from them to the company for a fee called a premium. Often you will see lower premiums with group products, and the reason for this is the law of large numbers, or the pooling of risk that Barb has talked about. The insurance agreement is a contract and is governed by contract law. The basic elements of a contract is an offer of coverage and an acceptance of the coverage in exchange for that fee. Once entered, the contract is enforceable. This can mean that if you've paid to have hospital care covered by an insurer and you end up in the hospital for a procedure defined by the policy as covered, you will look to that insurer to fulfill its obligations. The basic elements of a contract are the offer of coverage, the acceptance of coverage, the consideration, also known as the money, and the intention to create a legal relationship. Unique aspects of a contract are terms such as network, in-network, out-of-network, HMO, PPO, POS, insurance premium and maximum out-of-pocket limits, which they sometimes will refer to as MOOP, cost-sharing terms such as deductibles, co-payments, and co-insurance, the terms of the coverage, terms of exclusions, and limitations and restrictions. Next slide, please. So long before the ACA and HIPAA, Wisconsin was a leader in consumer protections. The next couple of slides will discuss the mandated benefits that must be offered by health insurers to Wisconsin consumers. I tried to scale these down as much as possible, but obviously some of them can be a little bit detailed, so we'll dive into them. For disabled children, health insurance coverage must cover dependent children beyond age 26 when the child is primarily dependent on the insured for support and maintenance. Insurers can and will require proof of that child's disability. For home health care, this coverage provides for the usual and customary fees to be paid for at least 40 home care visits per year. Home health coverage may include intermittent home nursing care, home health aid services, various types of therapies, medical supplies, and medication prescribed under that home health plan. Skilled nursing care is health insurance that covers hospital expenses must cover at least 30 days of skilled nursing care to patients who enter a licensed skilled facility within 24 hours after discharge from the hospital. Coverage may be limited to care that is medically necessary as certified by the attending physician. For kidney disease and transplants, insurance covering hospital expenses must provide inpatient and outpatient treatment of kidney disease, including dialysis, transplantation, and donor-related services. Health insurance must provide coverage from the moment of birth for a newborn child of the insured. The newborn shall receive the same coverage the policy provides for any children covered or eligible for coverage under the policy. Policies may require notification of the child's birth and payment of any additional premiums due within 60 days after that birth. A health insurance policy covering dependent children must cover adopted children and children placed for adoption by the same terms and conditions as other children. For grandchildren, health insurance providing coverage for any child of the insured shall also provide the same coverage for all children of that child until the child reaches the age of 18. Health insurance covers expenses for the treatment of health insurance coverage for the treatment of diabetes shall provide coverage for insulin infusion pumps, other equipment and supplies, insulin and other prescription medications, diabetic self-management education programs as well. Insurers may apply the same limitations, exclusions, deductibles, and co-insurance provisions that they apply to any other covered expenses. If a group policy provides maternity coverage for anyone under the policy, it must provide coverage for all persons covered under the policy. Mammograms are for women ages 50 to 65, and they must be covered annually. For women between the ages of 45 and 49, we offer 2 examinations by low-dose mammography. Coverage is required regardless of whether this woman has shown any symptoms. And lastly, for HIV, any health insurance providing coverage of prescription medicine shall provide coverage for each FDA-approved drug prescribed by the insured's physician for the treatment of HIV infection or an illness or medical condition arising from or related to an HIV infection. And that is subject to deductibles and copays that would generally apply to any other prescriptions. Next slide, please. So yes, we do have quite a few mandated benefits. Again, I'll try to keep this short and sweet, but some of them do have, again, a lot of spider webs to them. So for hearing aids, this is required to provide coverage for hearing aids, cochlear implants, and related treatment prescribed by a physician or a licensed audiologist for children under the age of 18. And the child must be certified as deaf or hearing impaired. This is also subject to any cost-sharing provisions. Contraceptives are required to, health insurance plans are required to provide coverage for contraceptives prescribed by a healthcare provider. Health insurance is required to provide coverage of routine medical services for the treatment of cancer provided to an insured in a cancer clinical trial if the services would be covered under the policy if the insured was not enrolled in the trial. However, insurance is not required to cover the cost of the treatment or the drug the trial is studying. Health insurance for dependents must provide coverage to an adult child of the applicant or the insured if the child is age 26. As we've touched on previously, health insurance providing coverage under mental health for inpatient hospital treatment or outpatient treatment must provide coverage for inpatient hospital services, outpatient services, and transitional treatment arrangements for the treatment of nervous and mental disorders and substance abuse disordered. Coverage cannot be more restrictive for coverage of the treatment of mental health disorders or substance abuse disorders conditions than the most common or frequent type of treatment limitations applied to the substantially all other coverage under the plan. Lead poisoning is required to provide coverage for blood tests for children under the age of 6 years old, according to the screening protocols established by the Department of Health Services. For TMJ, a policy providing coverage of any diagnostic or surgical procedure involving a bone, joint, muscle, or tissue are required to provide coverage for diagnostic procedures and medically necessary surgery or non-surgical treatment for the correction of TMJ disorders. Insurance providing coverage for mastectomy is required to provide coverage of breast reconstruction of the affected tissue incident to a mastectomy. For dental care, it is required to provide coverage for charges incurred and anesthetics provided in conjunction with dental care for a child under the age of 5 of an individual who has a chronic disability or an individual who has a medical condition requiring hospitalization or general anesthesia for dental care. Under immunizations for children, this provides coverage for a dependent of an insured for appropriate and necessary immunizations for all children under the age of 6. This coverage may not be subject to any deductibles, copay, or coinsurance under the plan. Autism spectrum disorders requires coverage for the treatment of autism disorders, which include autism disorder, Asperger's syndrome, and pervasive developmental disorder not otherwise specified. Coverage must be provided for evidence-based treatment of autism spectrum disorders if the treatment is provided and prescribed by a physician and provided by other qualified providers. And lastly, for student on medical leave, health insurance providing coverage for a person as a dependent of the insured must provide coverage if the person is a full-time student and shall continue to provide coverage for the dependent if, due to a medical necessity leave of absence, he or she ceases to be a full-time student. And again, a company may require proof of that medical necessity leave of absence. Next slide, please. For contingent mandated benefits, what we mean here by the word contingent is if the mandate sets up a what if requirement, then for eye drops, every health insurance policy that provides coverage of prescription eye drops shall cover a refill of the prescription eye drops if the requested refill does not exceed the number of refills allowed by the prescription. For oral chemo, health insurance covering injected or intravenous chemotherapy or oral chemotherapy is prohibited from requiring a higher copayment, deductible, or coinsurance amount for oral chemotherapy than required for injected or the intravenous chemotherapy. Colorectal cancer requires health insurance covering any diagnostic or surgical procedure, is required to cover examinations and laboratory tests for any insured who is age 50 or older, and for any insured age 50 and younger who is at a high risk for colorectal cancer. Under chiropractic benefits, this is a required service based on the coverage based on the services. The insurer cannot discriminate what services the provider is offering as long as that provider is acting within the scope of their license. So for an example, a chiropractor should not be administering an eye exam to their patient unless they have the license to do so. And lastly, for coverage of COVID-19 testing, every health insurance policy that generally covers testing for infectious diseases shall provide coverage of testing for COVID-19 without imposing any copayment or coinsurance on the individual covered under the policy or plan. Next slide, please. So as we've talked about previously, these are some of the key practices our office monitors. An advertisement should not exaggerate a benefit and should be sufficiently complete and clear to avoid deception or the tendency to mislead or deceive. You need to avoid providing your opinions on companies or products. You are to educate the consumer so they can make the best decision possible for themselves or their families. What types of marketing practices are unfair? Again, as we've touched on previously, those are some of the examples listed on this slide. Again, avoid your best to offer opinions to people. Next slide, please. So we've come to our next polling question. The following are examples for unfair marketing practices. A, misrepresentation. B, unfair inducements. C, undue influence. Or D, all of the above.
Everyone's doing great. Get your answer in. We've got about 70% of people who have participated. Please take a moment to answer the polling question. Okay, we'll give folks about 10 more seconds to answer the question. The following are examples of unfair marketing practices. Misrepresentation, unfair inducements, undue influence, or all of the above. All right, we can go ahead and wrap up that polling question.
Wow, great job, guys. The answer is D, all of the above. All three do represent examples of unfair marketing practices. So great job, everybody. Next slide, please. An agent or insurer must ask questions that are necessary to determine that the purchase of each insurance policy is suitable for the prospective buyer. This can be an area where we can see a lot of complaints, especially against agents when it comes to dealing with the senior population. Make sure to take as much time as needed to ensure that the person you are talking to fully understands in detail what is being offered to them. Per state law, as we've previously talked about, the insurer is responsible for the acts of their appointed agents when it comes to the marketing, selling, and servicing of their products. For example, I did once have a complaint where the consumer had provided a written notice to their agent with the indication that they wanted to cancel the policy. Regrettably, the agent didn't follow through on sending that notice to the company. It wasn't discovered till months later. Normally, in that type of situation, because the cancellation at that point was going so far back, the company would have not honored that request. But because their agent had possession of it and did not act in an appropriate time frame, they were required by statute to backdate that cancellation. Next slide, please. So again, Barb talked on these types of policies earlier. The short-term limited duration policy was originally designed to fill gaps when a person was between jobs and possibly, again, with COBRA premiums, they can be extremely expensive. And this is an alternative for folks to fill that gap until their next policy under a group or wherever they're going to get it from can kick in. Cancellation or non-renewal of these types of policies will not typically trigger a special enrollment period under the ACA. There is no guaranteed renewal of this type of policy, and the insured may not be able to even renew the current coverage, as the company by state law does not have to offer a renewal. Please note that consumers cannot use ACA subsidies towards the short-term plan premiums. Next slide, please. So again, healthcare sharing ministries are not discounted insurance plans, nor are they traditional health plans. They are non-insurance entities in which members share a common set of ethical or religious beliefs and share medical expenses among members in accordance with those beliefs. As we have touched on earlier, the member is required to pay all medical bills first and then post in a newsletter for other members to donate funds to help offset that person's healthcare expenses. Next slide, please. States can still apply to become a state-based exchange or partner with the federal government to establish the state partnership exchange. In this form, oversight responsibilities are split between the states and federal governments. There are currently 17 states that have their own ACA state-based exchanges, but Wisconsin is not one of them. For us, Minnesota is the closest state that has a state-based exchange. Be very aware of this when you're talking to your clients as far as where they're residing, especially obviously on the western side of the state. Next slide, please. Under the Affordable Care Act, an insurance plan sold on the health insurance exchange must be certified by the health insurance marketplace. And once certified, it becomes a qualified health plan or QHP. QHPs provide essential health benefits. They follow established limits on cost sharing, like deductibles, co-payments, and out-of-pocket maximum amounts, and meet other requirements. All qualified health plans must meet the Affordable Care Act's requirement for having health coverage known as Minimum Essential Coverage, or MEC. A health insurance company, as we've talked about, must also offer a product off exchange to the public. Next slide, please. So under the MEC, or Minimum Essential Coverage, again, the ACA requires that all Americans have access to health insurance that qualifies as minimum essential coverage. Comprehensive individual and small group health plans, most associated employer plans, and governmental plans such as Medicare all qualify as minimum essential coverage. Short-term health policies and limited benefit plans such as specified disease, hospital indemnity, and other limited policies are not considered minimum health coverage, or minimum essential coverage. Next slide, please. Essential health benefits are a set of healthcare service categories that must be covered by all comprehensive individual and small group health plans subject to the ACA. Again, plans offered on the exchange and off the exchange must cover essential health benefits. Essential health benefits must include the items and services within at least services listing the following 10 categories listed on this slide. EHBs also include all Wisconsin mandated benefits, as we talked about a few slides ago. The ACA provides that each state establish an essential health benefit benchmark package to serve as the minimum standards for plans required to offer the EHBs in the state. In Wisconsin, the plan is simply called the Wisconsin EHB Benchmark Plan. Next slide, please. The ACA provides a federal tax credit to help individuals and families afford healthcare coverage purchased through the health insurance exchange. The premium tax credit can be taken in advance to offset the monthly premium, or it can be in the form of a refund at the end of the year, as we've previously discussed. Cost sharing reduction is a type of financial assistance under the ACA. It is based on an individual's income and paid directly to the insurance company. It helps to lower the amount individuals will have to pay out of pocket for deductibles, coinsurance, and co-pays. But please note, the cost sharing reduction is only available through the health insurance exchange for individuals with incomes below certain levels and who choose the health plan from the silver metal tier plan category. Lastly, the ACA also includes permanent reauthorization of the Indian Healthcare Improvement Act, which extends current law and authorizes new programs and services within the Indian Health Service. For American Indians and Alaska Natives, the ACA helps address health disparities by investing in prevention and wellness and increasing access to affordable care coverage. Next slide, please. So the healthcare.gov website is a fairly interactive website. After entering in the information about an individual or family, the website will assist you and walk you through the next steps. If the system detects a person may be eligible for Medicaid, it will forward their information to that specific state agency for them to contact the consumer. The website also will help determine if a consumer is eligible for cost sharing reductions or the APTC, which is the Advanced Premium Tax Credit. Next slide, please. As we previously talked about, the ACA provides a federal tax credit to help individuals and families afford health coverage purchased through the health insurance exchange. Cost sharing reduction is a type of financial assistance available under the ACA. Wisconsin insurers also offer plans off the federal exchange. They may have similar coverages and can be potentially less costly. Next slide, please. As we previously talked about, a contract between a health insurance company and a consumer is where the company agrees to provide coverage applicable to the language in the policy in exchange for premium paid and any out-of-pocket costs by the consumers. Make sure to understand yourself the frequent terms relating to health insurance policies. These terms can include such as deductibles, coinsurance, co-payments, HMOs, PPOs, etc. They're all terms that you must be confident in explaining to your customers. Next slide, please. Cost sharing is a term used in health insurance, so it is important to understand and to be able to explain the 3 out-of-pocket possibilities for a member that fall under each blanket term. For coinsurance, that is the percentage of a billed service that a consumer may be responsible for. For example, if you had a bill for $100 for a piece of durable medical equipment, it means that the consumer would be responsible for 10% of that before the insurance company would pay their portion of it. A copayment is a set or flat fee that would be required by the consumer to pay up front. For an example, if you take your child to the pediatrician, there may be a $10 copayment that is frequently collected when you check in for that appointment. And lastly, deductibles are fixed dollar amounts that must be paid before the insurance policy will begin to pay for any covered service. Again, it's important to read the policy or the summary of benefits and coverages to understand what types of payments count towards meeting that deductible. Next slide, please. Understanding the concepts of cost sharing is key to balancing affordability of the premiums and overall out-of-pocket expenses for the consumers. Again, taking the time to explain these possibilities to your consumers will be key in educating them to make the best possible decision on what plan they are going to choose. Next slide, please. So earlier we touched on the sample summary of benefits in this earlier presentation. This is the sample that can be found on the healthcare.gov website. And this is just a brief snapshot of the plan's important features. Next slide, please. Many insurers have preferred networks of providers. As we've previously touched upon, HMOs offer the least flexibility, but usually have the lowest monthly cost, where EPOs are a bit more flexible, but usually cost more than the HMOs. PPO or preferred provider organizations offer the most flexibility, but typically can be the most expensive. Next slide, please. We have touched on the first two bullet points in this previous slides. Insurers offering qualified health plans must provide the most comprehensive coverage for you. This means that once cost sharing is met, you'll have the broadest coverage in the event that you or someone in your family becomes ill. They also must be compliant with the ACA. These plans cover essential health benefits like preventative care visits with no cost sharing. To control the cost of prescription medications, the Wisconsin legislature passed a law in March of 2021 requiring pharmacy benefit managers, or PBMs, to be licensed and regulated by our office. The goal of the oversight is to increase transparency, control costs, and protect consumers. Pharmacy benefit managers increase a patient's access to medications by negotiating directly with drug manufacturers or wholesalers. Next slide, please. And again, this is just another page of the summary of benefits. We've got a couple of more of them coming up, but this is the example that you will find on the healthcare.com, excuse me, healthcare.gov website. Next slide, please.
Shelly, we do have a question, and I
Okay.
think we should go back and address it if you're okay with that.
Of course.
So the question is about deductibles, and it's about, I'm trying to go back to the right slide. About whether they must be incurred or paid before the plan begins paying. Just a clarification.
It's a really good question. I would assume that it's a little bit of both. Obviously, you have to pay your deductible out of pocket. So you have to incur the expense as well. So again, you may go to an office visit that costs $100. We'll just use for an example. Well, that'll be something that will go towards your deductible once the insurance company processes the claim. That is something that you will incur out of your pocket as well. I'm not sure if I'm answering the question quite correctly or not, but I think it's a little bit of both.
Okay, thanks for addressing it.
You bet.
Well, if we get a follow-up one, I'll let you know, and I'll go back to where we were.
Of course.
Here.
All right. So the limitations and exclusions are some of the provisions that are often overlooked by consumers most frequently because they don't think that such issues or sets of circumstances could or would ever happen to their families. For instance, maternity coverage is provided under a health plan, but some of these plans might not provide coverage for delivery of the baby if you travel away from your home during the last 2 to 3 months of your pregnancy. I've definitely seen wording within a health insurance policy that says, again, for example, if you travel more than 100 miles away from your intended delivery hospital, they may not cover you for the last 6 to 8 weeks of that pregnancy. So it's definitely something to carefully read when you have an insurance policy like this. Exclusions can occur when a company feels a treatment or therapy is not medically necessary. As we have mentioned here before, OCI and our examiners cannot make medical determinations or the necessity of a treatment. Next slide, please. And again, this is just the example off the healthcare.gov website of that summary of benefits. Next slide, please. As a navigator, you are trained to assist consumers to look at all their healthcare options through the marketplace, which includes conveying accurate, unbiased information so that they can make an informed decision. This can also mean completing eligibility and enrollment forms as well. Taking the time to educate and raise awareness about the federal exchange is vital to becoming successful every day in your role as a navigator. Next slide, please. And this is just the last page off that sample summary of benefits. So we'll go to the next slide, please. And we have come to our last polling question. So which of the following should be considered when selecting a health insurance plan? A, premium, B, cost sharing, C, network and coverage, or D, all of the above?
You're doing great. We've got 72% participation. So please, if you haven't taken time to do so yet, answer the question, which of the following should be considered when selecting a health insurance plan? A, premium, B, cost sharing, C, network and coverage, or D, all of the above? We're getting close. I'm going to give it another 10 seconds and then we'll end the poll.
Great job, everybody. The answer is D, all of the above. Again, it's key for you as a navigator or CAC to make sure that you're educating your consumers that they need to take into account all of these factors when deciding on the type of plan that they're going to purchase. It's not just about the monthly premium. It's about the co-pays, the co-insurance, the cost sharing, but obviously, again, making sure that the doctors they want to see are in the network that they're looking at choosing. So next slide, please. And we have come to the end of our presentation. I apparently went through that extremely fast, but on behalf of Barb and I, we'd like to thank you, for having us provide this information. And if you have any questions, please go ahead and put them in the Q&A now.
Let's give folks just a little bit of time to put their questions in the Q&A. We have one, but I think I'm going to get some clarification on it. Shelly, can you see the question?
Give me 1 second here.
Okay. Why don't you take a look at the question and then we'll take a moment. I think it's going back to the earlier question on deductibles that we had.
Barb, do you have a better idea?
Yeah, I think I know what they're asking, and they're right that what the plan is responsible for paying is not contingent on whether a consumer has paid a claim or not, or paid their deductible amount. The insurance company is going to look at the incurred costs and ensure that. Now, obviously, the doctor, the facility, when they see that the consumer is responsible because it's a deductible, they are going to bill the consumer and do whatever they need to do to collect that claim. And that could even include If you don't pay your deductible, we're not going to see you, we're not willing to see you. A doctor can do that. But the insurance company itself is going to look at incurred costs. Is that helpful?
Yeah, I think that was very helpful. And I think that got to the heart of the matter. So thank you both for addressing that question. If we have more questions, go ahead and put them in the chat. I'm going to go back, and there were several questions where I did some written answers, but just for the benefit of the group, I'm going to just walk through some of those written answers so everybody has an opportunity to hear them. We had several people ask about where do you find information on the Navigator exam? And I'm going to put the link to OCI's website in the chat again. And you can also conveniently, it's at the bottom of this screen. If you go to that web page, you will see links to get more information on the exam. And just to be clear, both certified application counselors and navigators take the same exam, and it is called I think it's called Navigator. I think I wrote it down in the chat somewhere because it has a number at the end of it. 2214, I think. And that exam is available in English, Spanish, and now Hmong language. So that people sometimes get certified application counselors sometimes get confused about like, oh, where's my exam when they go to the webpage to register for the exam. They're looking for something that says certified application counselor. You're looking for that Navigator exam. I also wanted to share the, just highlight for you all that the Centers for Medicare and Medicaid, CMS, has training materials on their website about getting through the federally facilitated marketplace training for navigators and certified application counselors. They have a video that kind of walks you through how to access the training, where to go. And they have detailed information about how to adjust your computer settings so that you're able to like play the recorded modules, and how to download your certificate that demonstrates that you completed that training. The materials are quite comprehensive. So I encourage everybody to go to that webpage, check out the materials. If you're having any trouble understanding how do I access the federal training modules, or you've tried to access and you've had problems, please use that resource. It is very helpful. I'm going to go back and check. I've stopped monitoring the Q&A, so I'm going to see if we have any questions. I don't see any new questions coming in. I also wanted to share, and we will share additional information about this later in the regular conference, and we'll update it on our webpage, on the Covering Wisconsin webpage as well. But on October 5th, which is a Wednesday, I believe, look at my calendar, we are going to have a kind of a opportunity for new navigators or certified application counselors to join a 1 hour more informal Zoom meeting where we're going to review next steps for becoming a certified application counselor or navigator. So we'll talk more about accessing the training, the FFM, the 2023 assister training on the marketplace. So if you're having any problems with that, or you have questions about that, you could attend that kind of informal opportunity to learn more about that. And we'll also talk about the exam and just how do you get registered to take the exam. We'll review again, we'll go through the exam outline and talk about, what the expected content of the exam is. And we'll talk about the study guide that the Office of the Commissioner of Insurance has put together to help you study for that exam. And I put that link in the chat both yesterday and today. the chapters to focus on in those materials are 1 through 4, but these are things that we'll discuss on the 5th. So look for that. I believe it's at 10 o'clock. So you can block it off on your calendar. I'm opening up my calendar now to make sure I'm getting the right date. Yep, 10 a.m. on October 5th. And that's called Next Steps to Becoming a CAC or Navigator. And it's really just an informal opportunity to join me, ask your questions. We'll review items and just hopefully provide a little bit more assistance and guidance in getting this done, because it is so important to have everybody trained. And if you're a navigator and you need to be licensed before November 1st, when the marketplace opens to consumers, and your assistance is really critical in getting people signed up for plans on the marketplace. So I am not seeing more questions come in. Mike, please correct me if I am wrong.
No, I don't see any questions either. So why don't we give it just another minute for anyone to ask their questions? Otherwise, I think we could probably end early.
I see one question. Will a link be sent out? If you go to the conference homepage, you'll be able to find all the materials. We'll post when we have a link for if you're asking about the October 5th session, we'll post it then. So just look at that website. Where is the study guide for the licensing test? Okay, I can, or maybe somebody already put that link in there again. The study guide for the licensing test can be found on, see this web page at the bottom of the screen. If you go to that web page, you will be able to navigate to the study guide. Any other questions? Not seeing any other questions. So I did not expect this at all, but we have finished early. Thank you all for attending pre-licensing training. We look forward to seeing you back at our main conference sessions. I want to give a big thanks to Shelly and Barbara, our presenters from the Office of the Commissioner of Insurance. Thank you so much. I really appreciate it. And I wish you all a great weekend. Enjoy the last of summer. I hope it's fantastic. And if you have questions, feel free to send them to myself or to Mike. Go to our conference homepage and you will find many of the materials that you're looking for. Thank you.